welcome back to the show, everybody watching on Facebook Live, and welcome back to the KM News Zoom Room. Dr. Rachel Leon-Guerrero up at UOG. It seems like, just yesterday we had you here talking about the Beetle Nut Project that you're undertaking, seeing another aspect of how Pacific Island people react and possibly some of the contributing factors caused by beetle nut. I want to talk about that in a little bit, but now you've got another awesome project, and you're looking for volunteers from our part of the world for the Protecting Life Project. So first of all, good morning and good to see you as always.
Hi, Jason. Good morning. It's great to be back. Yeah, it just seemed like a couple of days ago I was with you guys, but yeah, so
you're staying busy.
Yeah, been very busy. Yeah, so this project is the UOG Radix Up Protecting Life Project, and this is a huge nationwide project, the Radix Up, that's all over the country. And University of Guam is partnered up with the School of Medicine, and we're trying to learn more about why Pacific Islanders, their attitudes toward COVID testing and vaccinations. And the reason is because if you look at the incidence of COVID among Pacific Islanders collectively, so you combine Chamorros from Guam and CNMI and American Samoa, Palau, FSM, collectively they have the highest morbidity and mortality rates associated with COVID-19. And that's huge, and we're probably the smallest ethnic group across the US, and yet we have the highest rates. So there's a real disparity, and so we just really want to learn more about what is it about it, and so we're really trying to encourage people to get tested, because by getting tested, then that's how you can know if you have it, and you can take early steps to get treated or to prevent yourself from getting exposed.
Mm-hmm. Okay, so Darian Rios is here also with UOG, and I believe Dr. Teo is here. It looks like the doctor dropped out. We'll try and get her back in. But Darian, good morning. Welcome to the show to you as well.
Good morning. Thank you.
Okay, so obviously, there's public health was just on Zoom last week, and they're epidemiologists, people who for a living track the nature of infectious disease, and they said, it's no big secret that you can kind of surmise that Guam and other Pacific people, we have a tendency based on our diet and maybe the fact that, this isn't a town like New York where you walk everywhere, or, Chris and I would go to King's over here, which is maybe 600 feet away, and we drive. So that has a tendency to lead to behavior patterns, which leads to health afflictions and everything like that. But your undertaking is you're actually looking to get hard data that would make a definitive correlation between the two, and then possibly be able to use this for public health research and say, okay, well, we got to change our behavior patterns if we want to improve our susceptibility to COVID. Is that correct?
Yeah.
Yes. So,
sorry,
go
ahead. No.
God, researchers are so polite. Oh, go ahead, Darian.
Yes. So we are trying to basically assess Pacific Islanders' knowledge and understanding of COVID-19, along with COVID testing. And the way we do that is by issuing out two surveys, which just ask about your understanding and your knowledge. So from that data, we can go ahead and form community engaged strategies that can format and fit their kind of perception. So we kind of see where the miscommunication or the lack of education comes in, and then we can try to formulate better strategies to kind of better inform the community about that.
Mm-hmm. How deep are you guys going into as far as how personal is the line of questioning? Because I know obviously generation, age demographics, gender, socioeconomic status, these play very, very important components into really understanding why we're so susceptible to COVID. So what are some of the questions that you'd be asking?
We basically asked just general demographic questions. So everything you said, your age, your village of residence. And I first do want to mention that all of our surveys are completely confidential. So we are unable to trace back your answers to you. So everybody's given this unique ID. So everything is confidential. But we basically just ask do you think questions do you think COVID-19 is real? How sick do you think you can get? your understanding or your trust in different media outlets, in like, how they disseminate information on COVID-19 and COVID-19 testing. So there's a really extensive amount of questions that we do ask that also relate to like, social and also family household, like who you live with, if like you come from, if like you're single or you're married or you have kids at home. So it's a lot of personal questions, but once again, all your answers are completely confidential.
Okay, Doc, in formulating this questioning and everything like that, how much involvement with your researchers and people like Darian did you really come up with? Because again, it's the diet, the exercise or lack thereof, and everything like that has really changed from generation to generation of our people. So in making sure that you authored a question which would be applicable to so many different types of Guamanians and everything like that, how did you incorporate their input?
You know what? We actually did not ask a lot of questions about like lifestyle habits, like diet. I think we asked a few questions about medical history, like if they're diabetic, what kind of medications they're taking, if they have high blood pressure. But to be honest, the questionnaire already, like most of the questions were already mandated by the CDC.
Okay, I see.
And NIH, right? So, boy.
This being a national program.
Yeah, being national, because they want to get consistent data from the whole country. So we didn't really want to ask too many more because, nobody wants to sit down and answer a survey for 2 hours, right? So we tried to keep it as as light as possible, but we didn't get into like how many servings of fruits and vegetables did you eat and do you exercise daily, but we did get some general health information, but it'll be interesting to see how people's beliefs toward getting vaccinated are related to their health status, their current health status.
Right.
Okay.
Yeah, it's an interesting, Doc, because actually this Pacific area COVID, it's this nonprofit group out of I want to say Oregon or California, but they actually reached out to me to do a message encouraging vaccination for Pacific Islanders because they were talking about the vaccination rates being low among the Pacific Islander community. And then also exactly what you guys are talking about, how we're disproportionately affected by the virus, and kind of just like looking at it, before we, I don't know if this cart before the horse, but before we do the actual research, but how much of our differing like family and cultural practices are in effect with this? Because look at Guam, right? One of the things that we talk about with the spread of the virus is the multi-generational households where Pacific Islanders are more likely to have, both a grandmother, a mother, and, a grandchild in the same house, which again goes back to the economics of it, right?
Yeah, that's right. I mean, I think before the vaccines came out last January, that was such a scary thing for a lot of households because, grandma's living at home or you can't even go visit grandma and grandpa. So the thing about the vaccine is it has really helped because the older generation are vaccinated, they feel a little bit more protected. And so I know in my family, we couldn't go see certain family members because, two of them were undergoing cancer treatment and there's no way we would do anything to compromise their immunity status. So, I know everybody has their own opinion about getting vaccinated and that's their personal choice. But I think, if you have members in your family who are immunocompromised, who have illnesses, who have diabetes, it's really important to, I know for myself, I went and visited my parents and they're in their 90s and I got vaccinated. I wanted to get vaccinated before I went and visited them because I didn't want to be the person that was responsible for exposing COVID to them. So I think, it's important that we're the multi-generational households. It's really important to respect and to help protect our family members.
Okay, well, a question for Darian now, because of course, the true value of a survey is it's only as good as the participants and sample size that you actually get. So how can people participate? We got your poster up right now and it says scan this if you want more information. But if people would really like to join the fight and contribute to the well-being of our community and everything, how can they get involved?
Sure. So we actually have a Google Forms link that basically can assess your eligibility. So we do have some eligibility requirements. And if you are eligible to participate, it basically asks for your name, your contact information, and your preferred time and date of contact. I think I've sent it. I'm not sure if you want me to send it, the URL link, but we also have a number that you can reach.
Sure.
It's 735-0215. So that'll directly go to my phone, and I would gladly speak to anybody and assess eligibility and explain more about our COVID-related.
Are you cool with me putting that in our comments right now on Facebook Live? Okay.
Yeah. That's awesome. Thank you.
Okay.
Can you talk a little bit more about the $35?
And get ready for your cell phone to be blowing up now because you're on the link, so you're gonna get a few calls.
What about the $35 in incentives, right? Because I know, Rachel, you talked about nobody wants to answer a 2-page survey, but if there's $35 in incentive involved, probably yeah. Go ahead.
Okay, so for every survey, so there's a total of 2 surveys that we kindly ask our participants to complete. And I want to let you know that there is an online option. So we don't ask you to come into the office and take it in person. There is an online option, which you can easily do on your phone. It takes around 15 to 20 minutes to complete. For every successful survey you complete, you do get a $10 gift certificate to one of our local grocery stores on Island. So for every survey, it's a $10 gift certificate. So there's a total of 2 surveys. So overall, that's $20. And if you recruit other eligible participants, that's an extra $5 per recruit. So, we always ask our participants to go out, recruit people from your household or your friends or anybody who just may be interested. And just for compensating, we'll compensate for your time and your effort. We give up to $35 in incentives. Also free research study shirts. We have our own nice logo.
So you guys are really using network effects and really making sure that this thing branches out.
You get a free shirt, guys.
Yeah. Hey, I've taken a bunch of surveys on surveymonkey.com, for free. So
you didn't get anything, I know.
Yeah, Darian, count me in. Count Chris in.
As long as they got it in Excel.
Okay, so I guess we'll wrap with this. And Dr. Luangaro, it's kind of like the same way we talked about your very important survey with about Pugwa and its impact on our community. How long are you going to be doing like the survey, and then after the data gathering phase is over and everything like that, when will the results hopefully be published, be made possible, or be made public, I should say?
I think we're going to be recruiting. We're trying to recruit 800 people here on Guam. And so far, we're not quite to the halfway point. So I think we've got another 4 to 6 months to recruit. And so we've already got a progress report with the data that's collected so far. And so I think as soon as the data is completely, we're finished with the data collection, I think it'll be within a month or 2 that we'll have results. So because this group that we're partnered with in Hawaii, they're very, they're very fast. And so and the data, because a lot of it's done online, it's uploaded to the server right away. So they have access to the data, and it makes it really fast. So it takes a lot of the human error out of it. So yeah, I think that as soon as the data collection is finished, within a couple of months, we'll be able to publish.
Yeah, so cool. It's a very swift project and everything like that. And as Darian said, I mean, there's a lot of incentives in it and everything like that. But the most important thing you're doing, you're helping our community understand why we are susceptible, and hopefully the research that comes from this and everything will change that, and we'll be able to help protect our people. So thank you both. I mean, this is a very worthwhile service you guys are doing.
Thank you so much, Jason. Thank you, Chris. We really appreciate you letting us come on.
And come back on, the both of you. We'd love to have you back on the show and see how things are going. And, like if the participation starts to wane, come back on and we'll say, you get a matching pair of shorts with the shirt or something like that.
We actually have a comment here. Darian Liu, you're doing an amazing job. Thank you. That's coming from Rio Crisostamo Rios.
That's my mom. Thanks, Mom.
Hey, Well, half a day. Good
I had a
morning,
feeling.
Mom.
There you
Your daughter is doing a really good thing
Right
for our
on,
community.
yeah.
You should be proud. Great work.
By the way, Miss Rhea, if you want to sign up for a survey, there's $35 in incentives. They're totally available. Thank you, ladies.
Thank you.
Thank you.
Bye.
All right.
Thanks again. Have
There
a
you
good day.
go. That's always cute when we get the family chiming in the comments.
I like that.
9:50. We're going to take a quick break, and the things are in the link, guys. If you want to sign up for this, it's a 2-page survey, super easy.
Yeah. And again, if you have any questions, Darian's number is there as well. That's in comments. 735-0215, I believe. And give her a call. Obviously, they're really, really nice people, and they're doing this to help keep us safe.
It's 9:51. The link continues next. Good morning.
The world of television is more